Welcome to Joint Effort PAs, where two orthopedic surgery PAs get real about life in medicine. From tips and tricks to professional growth, work-life balance, and everything in between. We're here to share what we've learned and what we're still figuring out. Let's get into it. Moving on from that.
I'm ready. I'm all
we had to have
up now.
Well, I am so turned up. We had to have a little off-camera discussion.
I know. I was going to bring some Prosecco today and I didn't.
Oh, man.
I feel like today would have been like a perfect day for that.
Yeah. I mean, I might have gotten more fired up about what I just talked about
I know.
had I had Prosecco in my system. So I don't know if that's a good thing or not a good thing.
We'll never know.
Well, recap. How's your week?
The week was good. I had a really good week. Yeah. So again, my clinic is 3 days and the OR is 2 days. So OR was good this week. They were very good days. So what we have decided in 2026 is we're going to level the F up, and 5 cases are now on our 4 case days. So we did 5 cases Tuesday, 5 cases Friday.
Yes.
So it felt
one at a time.
It felt very filling.
Yeah. Was it like, are things like slower than before? Or are you doing those 5 in the same time as the 4? Is that like the level up?
No, I think what we're doing is we're just pushing it, meaning like we would have normally said 4 and we're very happy to be done at like 2:30 or 3.
Okay.
So now we're just deciding that we need to go till 4.
Okay.
Or later.
How does that work?
It's funny you ask because
I get in trouble when that happens.
No, I do. I am writing the line very. I don't know. I'm trying to feel the waters.
Yeah.
So when my supervising physician said, "Hey, we're doing 5," and then I communicated that, they were like, "Whoa, December we were open till 5, but now in January we're open till 3." I was like, "Oh, okay." So. But like 3:10, 3:15, 3:30.
3 whenever you get done.
I know.
Yeah. So
Tuesday we were done before 4 with 5 cases.
Yeah.
And then Friday we were here and then we went to another facility and we were done around 4. So we did 5 cases with some travel time, which
that's
impressive.
I mean, the travel time always is longer than you think it's going to be.
Yes.
Like the changing is
so annoying. I know. So, so surgery wise, it was good. Clinic wise, it was good. I had a patient give me like really, really good feedback to my medical assistant about one of the visits that I don't enjoy very much. Like it's new visit, patellofemoral pain. So it was bilateral knee, no history of injury, already went to urgent care, blah, blah, blah. Like, I just want to know what you want. Just want to know what you want.
Yeah.
Is this like, you want a diagnosis? Do you want me to,
do you know, like,
do you need to know, like, do you want me to cure you?
Yeah.
So I will tailor my conversation based on, is this the first time you're hearing this? Can I deliver this in a way that you'll understand? Anyway, so, I didn't feel like I did a good job. Like it felt like I delivered the information, but I felt like I was like, I don't know, like it just felt very like I went
all over the place
and then I went
kind of thing.
there,
Yeah.
And then
and you leave and you're like, ugh.
No, I left and I was like,
didn't like that. Yeah, maybe.
You know?
Yeah.
And she had said to my medical assistant, she's, oh my God, I love her. She did not shove pills at me. She did not shove injections at me. And I was like, okay.
Yeah,
like I didn't, but I just felt like it was one of those like situations.
Finally a positive response.
Yeah. And then I also got someone who I was moderately annoyed because it was new patient 78, second opinion for a total knee. And I was being optimistic and I was like, you know what? Maybe it was either one of 2 scenarios. One, someone suggested they wanted a total knee. They wanted my opinion. 2, they already had a total knee. And they wanted an opinion why it hurts.
Messed up with it, yeah.
So I saw it on the schedule. I thought someone would like call for follow-up questions. Nobody decided to do that.
Right.
So I was like, okay. So it was actually a patient that a really good patient and, you know, husband and wife and kid and grandkid and nephew and sister, they all see us and they bring us sweet potatoes every year from their farm.
Oh, yes. Yeah.
And anyway, so it was their neighbor and she was scheduled for a total. Listen to this. And again, divergent, but here we go.
Yeah.
78-year-old female seen by somebody else in the area. She goes to like some Viking cruise thing and is walking through the cobblestones in Europe and her knee hurts.
Okay.
Like I get that, right?
Yeah.
And then she comes home, sees ortho. They do a steroid injection. Of course, her knee feels fine after that.
Yeah.
Fast forward a couple months later, now it's October. Her knee kind of hurts again. They do 1 of 3 viscos, and her only complaint is it hurts when I stand.
Okay.
Like it's just the
getting up part.
That's it.
Like,
Once she's up, she's fine.
Yeah.
She's
Yeah,
sleeping
yeah.
fine. She's walking fine. She can do everything else fine. And they said, you need a total.
Oh my God.
And she's scheduled next month for a total. So she came in and she's like, I just don't feel like I've tried everything.
What do her x-rays even look like? Like bad or?
No. Yeah. So her weight bearing surface, like Kale grade 1, like my knees probably look worse than hers. She does have patellofemoral OA, which I did explain to her is hard to treat, but at the same time, you may still have pain when you stand up after that knee replacement, sweetie.
Yeah, yeah.
So
it's not gonna fix everything perfectly.
So she's gonna try other things, and she seemed to be very happy with the visit. But those are my highlights for the week. What about you?
I love that. I had a good week overall. It was just like a weird week. There was like a lot of, when things throw you off. I had a lot of like curveballs in my week that threw me off. Like I think my clinics were mostly good. They were pretty busy. I saw a 107-year-old patient yesterday.
Yes.
Yeah.
On their way to 108 or just 107?
Well, I don't know. I didn't look at when their birthday was.
I did. I saw someone that was not that one. I had a 102 patient.
Yeah.
And I've seen her now. And every time I see her, I'm like, we'll see
What's
again,
next?
right?
Yeah.
Yeah.
That's like a thing. I was like, when will you be 108?
So she's 102. She was 102 in November.
Oh my God.
So Aunt Mary.
Wow.
That's what I call her.
I love that. Yeah, no, it was super cool. She didn't really look 107. I don't know what I expected a 107-year-old to look like a skeleton.
I mean, I don't know.
That's terrible. But yeah, like everything, the week was just full of curveballs.
Yeah.
Tuesday was really, really good. We were up in one of our more rural hospital settings to operate, which I know isn't y'all's favorite place to be. Typically, bad things happen there. Mm-hmm. But it actually was really, really good. Everything flowed nicely. We did some interesting things. We did a knuckle MCP implant with pyrocarbon for the first time, and it was really cool.
That's cool.
And those are just like long days because Tuesdays we do evening clinics too. So it's like a full day.
Keeps going. Yeah.
And then Wednesday I closed my clinic down halfway through or a little after halfway through to go assist with a big proximal humerus fracture that there was intent to nail. And the surgeon I work with, we don't typically do that procedure. So he had another, one of our partners here, double scrub it. Those are like the curveball situations. Like, what?
I heard you bailed to a reverse. Is that the same?
Yes.
So I was like, how do you bail to a reverse? Yeah. I mean, I get it. Yeah. And Hugh explained, our rep explained like when it happened.
Like the humeral head's gone. So shove a stem in.
Like, wow, that's a good second plan that you were prepared for.
Yeah. So typically for those, like we either like, if we're in a hospital setting, we'll always have this stuff for a reverse. Yeah. Whether typically it's a plate with the bail plan being a reverse. Yeah. This time it was a nail versus plate versus reverse.
Okay.
But also like from what I was hearing, because I couldn't really see much, the cup was not in great shape. So yeah, even like double or like been in double scrub situations, it's like it really like that throws off. I'm like, what am I supposed to do? Like I don't know what to do with my hands, kind of thing. So
you don't know what your role is. It's like Well, with this vision thing, it's like partial knees. We used to do a lot of partial knees, and I'd be way over here retracting, and I'm like, how's it going over there? And like the doc's in there, and I'm kind of like I hated that. But even worse with a double scrub, you're just like, no, you go. And they're like, no, you go. And
well, like,
oh, okay.
Yeah. I'm no longer like second in line anymore, which is fine. Like I get that that's not like how it's supposed to be. And honestly, in the event we were doing this nail, it was more just so that we could learn the technique and like that would be cool to see. So I was there observationally.
Okay, initially, so it was known like what your role was, kind of.
Initially, and then we bailed to that, and like I'm so like stepwise with the totals that
so
I'm
you're like, excuse me.
So
I will now take your spot.
Well, I'm just like I know the other steps. I know what to do like outside of what I do, but I'm not used like it's just not the natural flow of things. So I feel very useless, and I'm like, what am I supposed to do? Like it's awkward. I'm like I'm like half in the scrub tech's way, like kind of taking their role. Plus we had a medical student. So add that into the mix, right?
Dude, speaking of that medical student.
Oh my God. I can't.
Okay.
Side note, if you're told to show up somewhere,
you
should fucking show up somewhere.
Yeah. All right, can I go to that story?
You can.
Okay.
Yeah.
So Monday, we we're finishing up clinic, get ready for our surgery day on Tuesday. Tuesday is like a home run day. It's like 5 solid cases. They're all complicated. Like I'm very excited about and an ACL like in there too.
Yeah, it was a good day.
So we had one of our surgeons come over with his medical student, excuse me, and said, hey, so this medical student is with me for the next however many weeks. I really want to get him into surgery. He really, really interested in ortho, which it does matter, right?
Yes, yeah.
So I get it. You're trying to sell it. So this is like post 5 o'clock Monday. Can he operate with you guys one of the days this week? And I'm looking at the schedule. And the doc who I work with, the conversation is directed to him. Yeah. I am over here and I can see the doc do this. And I'm like staring at him, right? Because I know the day is Tuesday. I know that, right? But that's like, it's my day.
Yeah, yeah. You're automatically
and I like to teach. I like to teach, but like whatever. So the whole thing here though is that the surgeon brought over the student for the airbag. Like I'm not going to say no if your student is right there. And I told you, I described this like my daughter coming over to me with her little friend saying, hey, can so-and-so sleep over? Like don't present your friend to me and put me on the spot and make me make a decision. I won't in that situation say yes. That's not true. 50% of the time I'll say yes, but I don't like being put on the spot. This was the exact same thing.
Yeah.
So I was like not annoyed at the outcome. It's fine. We'll have a student. I just have to get my head in the right place.
Yeah. Yeah.
The student didn't show up for case 1. Case 2 showed up toward the end of case 2. I said for case 3, okay, so you scrub? And he was like, oh, I'm not scrubbing. So I was like relieved, but also like, that's weird.
Yeah.
And then he watched his shoulder. And then we had 2 cases after that. And he was like, I can't stick around. I have to go. I was like,
when Beth texted me that, I was like, he's dead to her.
He's dead, but you're dead. Like, I will not invest in you. You clearly don't want to be here.
Yeah.
Your surgeon, when he said start times at 7, you sat there like, oh my God, thank you so much. And I even said to him, do you like ortho? And he's like, oh, that's where I want to match. And I was like, good fucking luck, buddy. Like, that was such a poor showing.
Yes. I hated that for everybody.
It made me sad for anyone wanting to go into ortho that is the representation that I now have of every single other student.
Right.
That I will now
like
have
it just
from
puts
you
a bad
guys.
taste in your mouth from that. Yeah.
So,
no, as soon as you sent me that, I was like, ugh.
Yeah.
I'm moderately crawl into a little hole in there.
An unwritten rule that you're not going to go tell. I'm not going to tell his supervising that he did that.
No, but I did.
But also I was like, I said to him, I was like, your boy sucks.
You sent me that text though, and I immediately went. And I was like,
guess what happened? Yeah. But like, whatever. I mean, you just got to hold people to standard. Okay. All right,
I know, but like, again, whatever. But it was a weird week, some weird curveballs. It was overall good cases. I mean, like, for example, for that.
Yeah.
Like I just have a very specific stepwise approach in my mind to most things, like even to the way we prep and drape. And like that was happening differently. Yeah. And I was like doing different things than I'm used to doing. Yeah. And I did cause the spider to fall down during timeout. So not even like a couple, not even a minute into the case, Beth. Yeah. It was bad. I did a lot of this week was not my prime.
It's okay. Yeah, but we always have next week. We had last week. You were in your prime last week. You will be in your prime next week.
Yeah. There's always next time, I guess. But yeah, so overall good. Then I got my 1-star review Friday, and I was like, yeah, you know what? Just moving on to a new week.
I knew that was going to come up. Hannah got a negative review, and we can categorize it as a negative review, but you decided to bring up the 1 star. So someone decided to just give you 1 star. And by the way, there is no choice of 0 stars.
There's no 0 stars. So that's the lowest you can go.
I know.
And to be fair, like 1-star reviews and negative reviews in general typically irritate me because I ruminate on like, what could I do better? And like, why do I suck as a person?
Yes.
This one in particular does not make me question why I suck as a person. It just makes me frustrated at the system that it allows for people to make ridiculous judgments based on like not true facts. Yeah. Or I don't know that they're not true facts, but just like it doesn't make sense.
No, and you responded to that criticism, meaning like our marketing person was like, hey, here's your 1 star, which leaves the floor open for like 2 responses.
Yeah.
Thank you. And then you say nothing else. Or what you did, which was like, this was actually the scenario and this is what I did. So I'm not really sure where there's room for improvement. Yeah. And in this situation, I just was like, and we're good. Like, I decided not to respond.
That's the end. Well, there was 2 options in my mind. I was like, either I'm not responding to this, but then it just makes it Like it was eating, it was chewing at me.
Of course
so
it was.
I
Yeah.
had to,
Yeah.
I had to respond. So I did, and I chose to. But again, next week will be better. We'll all be, on our game and faster.
But you know what I look to do? Faster. I look to see if that patient canceled their appointment with you and they did not, or
they didn't
get off of your schedule and now must see the doctor. But they didn't. That's exactly where my mind went to, because I was like, are they going to come back and see you?
Yeah. No, that happens. Unfortunately, frequently.
Yeah.
It's interesting. Like I've been following one, I'm sure you do the same.
Yeah.
I've been following a case where that specifically happened. I saw the patient. I actually took them from urgent care because urgent care was very busy. Saw them, treated appropriately. They came back a couple days later because one of the splints or braces or whatever that was offered to them, they were uncomfortable with. Like they just weren't really wanting any option I was giving them. And then had a follow-up scheduled, called to cancel it, only wanted to be on the doc's schedule, which fine, cool, whatever.
Yeah.
But like the notes in there are like, never wants to see the PA again because basically like they hate me. I ruined something for them.
Yeah.
And I guess the feedback, she was like, I just want to know what's wrong with me and get to the root cause and find a solution.
Yeah.
Which like I had already given her the root. Like I was like, this is what I think it is. And this is what our options are. So he gets an MRI. I'm like stalking. I see the MRI come back. It says what I told her it was.
Yeah.
The options are now still the same.
Yeah.
And I'm like, in this person's mind, are they ever going to think like, oh, wait, they were right all along?
No.
Never.
They're like, thank God the doctor figured it out.
Yeah. Like, wow, I'm so glad they ordered an MRI.
Can I get my money back for the visit that I paid for the PA who
didn't do anything for me and didn't know what was. Yeah. Amazing.
Yeah.
Love that. But
anyway,
there's next week.
There's always next week.
Always room for more 1-stars. No, hopefully only 5s next week. No, next week is going to be a 5-star.
But you also had
Speedy Gonzalez.
I know, but you also had, and then we'll put it to rest. You also had really good reviews leading up to that.
I did, yeah. Like
it stood out to me.
The bad one stands out. Yeah,
no, the bad ones stand out, but so much so that you had. God damn, I gotta read it now.
I know which one you're thinking of.
Okay.
Yeah. I think at least.
She's absolutely great. The smile, her caring attitude, her quickness, your professionalism, your knowledge all goes into her and who she is as a person. Doesn't say that, but that's how I'm reading it.
Yes. Yeah.
And this is my first time seeing her. I love it. Y'all give her praise.
Yeah.
Give her a raise. Excuse me. I just read that. It said give her a raise.
Give me a raise. Wow.
Yeah. And then again, Hannah's the gold standard of PAs. Yeah, knowledgeable, articulate, precise, and unerring with treatment and consultation. So good. Yeah. Which makes us, hate the bad ones. So,
yeah. It makes the bad one, like, hopefully people read that and they'll be like, this person's ridiculous. Because that's what I think when I read it.
Yeah. Okay.
So what we wanted to do today was, it's Valentine's Day. And initially my thought was, why don't we do like a little game show-esque thing? I have this game that's been sitting on like one of my counters, and it's like a couples game, and it's little like funny questions you can ask somebody. I was like, I'll just bring this box. So then I started pulling out the cards, and I was like, this is not what we should read off to each other. But it sparked the idea for it. So we'll just do like a little Q&A session, kind of like a would you rather, would I think Beth would rather. Yeah. So yeah. All right. I'm going to start. Okay. Okay. And this is things that I feel like maybe I know about you, but maybe I don't. Maybe I'll learn something. Okay. So what drives you crazier? If you go into a room and it's not stocked and like you have to wrap somebody with an ace bandage and you like open the drawer and it's not in there and your hands are already full of other things, or you go into like a very typical normal case and scrub tech's not prepared for it. Okay. And I think I know the answer. And I would say it is the room not being stocked. It
is room not being stocked. I can 100% roll if a scrub tech isn't prepared, because then I will like go into like fight or flight mode. Like, oh my God, we need to do that.
And then you become that too.
No, I'd become that too. Yeah. And then I start sweating and it's fine. But when the room is not stocked, specifically when like the day before, the week before, the other time before, it is not stocked, it really bothers me. And my coworkers will say to me like, oh my God, no, I swear I just did that. I got an email on Friday from another physician
about that. Yes.
That said, it was scathing. And I see patients on one side of the hall, the doc sees patients on the other. My first question was, what side of the hall was it? And he was like, it was both. So I was like, okay, lay it all out. And he did. He was like, the rooms were not stocked. There was none of this. There was none of that. And this was dirty. And I was like, you're right. I literally said, you're right.
Yeah.
You're right. Like I have nothing else to say.
Yeah.
But I just think when it's not important to someone else, it's just not important. But yes, you are right. It drives me up the wall.
Yeah.
Up the wall.
Yeah.
Yeah.
Yeah. Because I mean, much like your PRP fiasco a week ago.
My
God. Or this week. No, it was this week.
I didn't even talk about it.
You didn't even talk about it. Are you not ready to talk about that?
No, we'll talk about it another time.
It was
carnage, okay? Like
carnage. But like if you're like you only have two hands and then sometimes needing to like leave the room and like there's not having something. It's just like
yes, if there's not supplies in the room, when someone puts you in a room, it's like they tie your hand behind your back. And they're like, good luck. And again, the scenario is
out to the wolves. You're like in the with the Coliseum with the lion.
Yes, with the doors closed. So it's like I'm being punished, where I then have two choices. I can like yell at the top of my lungs. Help! Yeah, help. And then I start like banging the wall, which I would never do because then the patient thinks I'm crazy. Or I like excuse me, I'll be right back. Then I come out of the room and I fucking stare daggers. I'm like, can I get a suture set?
Do you like roll yourself out on the little chair, like with your sticker
what I do, actually, it's my move. I will keep my gloves on, which indicates like I'm in the middle of something. Yeah. I'm like, can I get a suture set? And they're like, oh God. Yeah. And then I get six.
Yeah.
And I'm like,
thrown at you.
Yeah. Okay.
Yeah.
You read that one correctly.
Yep. Yeah. I did.
Okay, my turn. What's worse? And this is like a schedule thing, because I know that you're like super type A with your schedule. What is worse for you? A 10-minute new patient slot or a 30-minute no-show hole in your schedule? I think the answer is B.
The 30-minute hole.
Yeah.
Yeah. I was actually thinking about this. I was talking to somebody about it yesterday. So yes, the double books irritate me, but I also kind of like the chaos of it. It's a challenge. Yeah. And I want to take the challenge. But when I have a hole, I feel, again, useless. I'm like...
Do you feel like someone did it on purpose?
Well, I just feel like, what am I, like, I'm not making use of myself.
Yeah.
So then I go to urgent care and I try to hunt something down from there.
That's what I do. I go to the other PA schedule.
Yeah.
So I will see like my papers or like here who's waiting for me, and then, they're already back. Then I will see the other one and I'll sit there. And he's often seeing a patient, and then there's one, and then there's two. And then I'll like read the room. Like his medical assistant will just place them there. Right. And I'm sitting there clearly doing nothing. And then I'm like, hey, do you want me to see one of those? Like, are you available to do that? Yeah, yes. I am available to do that right now. Awkwardly. And for probably the next 26 minutes.
About it. Yeah. So I don't like the holes. And I will like look at the doc's schedule. Like what can I like poach from here? And then revert to urgent care. Do you ever like poach something from your doc's schedule and then you're like, wow, this was a mistake. Like, why did I do this?
Yeah. In fact, I'm still seeing someone that I poached. Like I thought it was a good idea.
You're like, let me help this one time. And 2 years later.
No, the one that he was like, oh, go in and do this injection. And the guy rolled on the back of his leg. He's like, hey, I have this cut here. And it turned into a wound vac. That was a poach. I poached that.
Man.
I was like, I'll see you back in a week. And the next thing I know, I was getting a wound vac. And next thing I know, he didn't trust me. And then I had to get an MRI. And then he told me about the friend whose leg was amputated.
Yeah, those never, they
Then he went on a camping trip and I like thought about him for 3 weeks.
Yeah.
He wrote a great review for the doc. I found it literally the other day. It's really funny. It's not funny. It's hurtful.
It's funny now, I guess, looking back. I don't know. Okay. So it'll be funny at some point. Okay. This one kind of similar to what you just said. Okay. So, okay. What bothers you more if you are about to go see a patient that needed x-rays done and they're not done, or they're done, but of the wrong side?
Done of the wrong side. Okay. I can see a patient without x-rays. In fact, if I know the patient needs the x-ray, like our post-ops, we will do x-rays for certain things at a 1 month. If they're waiting forever for an x-ray, we're just not getting the x-ray. We'll do it next time.
Yeah.
Right.
Yeah.
If I see a patient that the x-ray is the wrong side, this has happened a couple times. So the wrist, you see wrists all day. The x-ray is like this.
Yeah. If they do bilaterals, you mean?
Okay. They do bilateral.
Yeah.
So the right is on the right the left is on the left. I've had x-ray techs tell me, no, like a knee, when we do a knee, the right is on the left and the left is on the right. But for the hand,
and they usually label them.
They label them. For the hand, they tell me that if you put the hands down, it's bilateral. It should be the same as the knee.
Okay.
That is not true 100% of the time.
Yeah.
Right?
Because like APPA, like, I don't know.
But here's the thing. If they were.
No, yeah, like that makes it like they should be.
No, but
like,
then
your
if
thumbs
it
are
wasn't.
this direction. Yeah. Yeah. Your pinkies would be next to each other. Yeah.
So unless you literally are like that. But anyway, so I was like, so I had the head of x-ray tell me, like, I know it's confusing. It's not mislabeled. This is the tech that did it. And I was like, I just need you to verbally tell me that that's what that was. Right.
Yeah.
Then I had the same tech. We had done a ACCC recon on someone. Okay. So a dislocated AC joint, then a reduced AC joint. We happened to do it with a reconstruction, not with a repair. So there was no hardware in there.
Okay.
I know we tried to do it with a repair, so I knew I should see the drill holes. I glanced at it and I was like, that looks great. I went to go talk to the patient and I was like, that's the wrong goddamn shoulder.
Oh.
So I was like, there's no way the post-op patient allowed the x-ray tech to x-ray
take the wrong side.
shoulder.
Yeah.
And it was labeled as if it was the operative shoulder.
Oh,
so I walked back and I was like, you x-rayed the wrong shoulder. And they were adamant that they had it. And I was like, I'm going to go ahead and pull up the old x-ray.
Yeah.
A week ago. You see the drill line through. The AC is like.
And it didn't fill in this fast.
And they were like, oh yeah, sorry. Oh yeah, sorry. Sorry.
I know.
Like if I didn't check, like.
Right. Then you can like have something. Then you look stupid to the patient. You're like, oh, it looks great.
And I had to go back in.
And be like, sorry, I don't know what I'm doing.
Yeah, but also neither do you.
Like,
you let the x-ray tech literally x-ray your wrong shoulder. So when we literally had that happen this week to someone. Over the wrong shoulder, weren't you like, hey, that's weird.
Yeah, like I didn't have surgery on this one.
Yeah.
But I mean, like, I don't know. I guess like, from the patient's perspective, or maybe they want to compare them. I don't know. But
I don't know. Anyway, mislabeled stuff.
Yeah.
Through the roof.
Yeah.
But when it's a delay in my process, I'm not waiting for the x-ray to go see the patient. Yeah. You'll get it when
But I guess circumstantial, right? Like there's certain things like I can't, like do it like
if
it's an ORIF. I don't know.
Yeah.
Like I can't really like magically just stare at you and be like, oh, it looks like it's totally healed.
Yeah, exactly.
Yeah. That'd be nice.
All right. When I'll go back to, I guess scheduling and workflow. And again, I think I know the answer to this, but I'm gonna let you answer it, and then let you know how I answer. Okay. Would you rather handle in clinic if your clinic is like all day of just routine carpal tunnel injection, trigger finger injection? Would that be more satisfying to you, or would like the complex consult, second opinion, like what would you rather do?
Complex, for sure.
Okay, I was going to go with it kind of depends on the day.
I mean, yeah, it depends on what your mindset is for sure, right? Yeah. Because like, and this could apply for an OR day too. Like if we can bust out 10 carpal tunnels and flip rooms and everything just like flows beautifully, that's a great day.
Yes.
But I also really like more so than that.
Yes.
Like doing something that involves having to think in different ways than I've thought before.
Yeah.
Right.
Yeah. The complex stuff.
Come up with different solutions.
Now, B, like a part 2 to the question, with those complex visits, do you enjoy them because you're challenging yourself mentally, or deep down inside you're winning over the patient?
For like an in-office visit, I think.
Like, do you walk out of that more satisfied because you're like, God, that was really challenging, or you're just like, that was challenging and they love me?
Well, sometimes they don't always love me though. Even if I'm like, it's challenging and I feel like I'm doing a good job and challenging myself, and I'm like, wow, I actually like am thinking through this, and like maybe whoever they've seen before has not gotten to this point with them.
Yeah.
But like, I don't know that that's always appreciated from their end. So I will say it's more satisfying to me probably than from what they think of me. Cause I mean, their interpretation of what they think of that.
But that's a growth moment, Hannah. I feel like you would have answered that very differently a couple years ago.
Or even a couple weeks ago, possibly. But yes. And then like from an OR setting, I mean, same thing. Like I like to do what I know how to do and what I'm good at. Sure. Yeah. But like, I like to also prove that I can do things better and more than what has previously thought I can do.
If I'm in the mood where, like, let's say yesterday was like a super complex day, I will welcome the routine injection day. However, if I'm doing an OR day and I'm like ready for this to be complex and it's super easy, it annoys me.
Yeah. Yeah. You're in a bad mood. Yeah.
I mean, it does. It actually turned me the complete opposite way.
And then can people tell? Are they like, why
yeah, probably.
Yeah.
Yeah, probably.
Yeah. I like to think people can't tell, but they
no,
can't.
I know. Well, that's why I delayed answering that. I don't think people outwardly can tell, but like, yeah, I'm like, it's annoying. I'm like, why am I doing it? Why did I get out of bed for this?
My next question to you is actually very relevant to that, which was, what do you love more, doing a complex cuff repair, like one that you went in thinking this is going to be 45 minutes, or I assume that's your typical kind of time frame ish, maybe.
Yep.
And it ends up being like a 2-hour thing. Yeah. Versus like you're just doing run of the mill ACL, doing your graft prep and everything goes beautifully and smoothly done on time. Like, what do you like more?
What do you think?
Well, it probably depends on the day, like we were saying, but I think depending on the end outcome of how that cuff repair goes, like if it went well in the end, then you probably enjoy that.
Yes.
Because it was like, it was new.
Yes.
Like exciting things were happening and then you had a good end result. If the cuff repair didn't go well in the end, then
So yesterday we were operating at 2 sites. There's 5 cases at one site, challenging to do it in an appropriate time.
Yeah.
2 sites, there's a travel time. We were there late, but they still weren't ready. So the day's going along.
Yeah.
Our last shoulder was supposed to be like a big revision, graft, whatever. And before, the doc was like, hey, I was reviewing this patient's chart last night. Like, they're osteoporotic. I don't think anything's going to stick. Why don't we just throw a balloon in? Mm-hmm. I was like, it's Friday. It was like post 3:00. Mm-hmm. I get it. Like, a balloon would be cool right now. And even the rep was like, sometimes I don't hate a balloon on a Friday afternoon. Yeah. But I was kind of like, but I was like ready for the whole thing.
To do the thing.
So we got in there and we ended up doing the whole thing. And I was like, I was like secretly like so excited. I did. I was just like, nah. No, but it was a good feeling. No, I mean, I don't, I enjoy kind of like, I don't want to say stumbling because that doesn't sound very professional, but I like working through the hard things to have the good results, especially if it's unexpected. Yeah. That stuff excites me.
Yeah.
Not that a balloon would have been like any less satisfying for the patient, but it would have been less satisfying for
you. But for Beth.
It's not about me. But no, that, complex rotator cuff.
Yes. Yeah. The complex stuff for sure.
All right. Any other clinical scenarios? So the room stuff we talked about. Yeah. Types of patients we talked about. I don't know if I'm going to open up a scab, but I'm going for it. What about a double book at 4:00? Okay. Which is like, or 4:30, whatever the last patient is of the day. Or someone who shows up late at 4:15, 4:20, 4:30. You're still there, but they show up late and they're expecting to be seen.
I am more irritated by the late show up because if I'm already double booked at 4, like I'm expecting that. Like I did that to myself, or somebody did that to me. But
I mean, like when I look at it at 8, I'm like, I'm annoyed. Like I'm annoyed that there's a double book, but
it's happening.
But what about when the 4:00 patient shows up late?
Yeah. No, I mean, like that's
you're there anyway.
Bad.
Yeah.
Well, I mean, I'm there anyway, but like now I'm later than,
Yeah. Yeah.
And it's always like a cast that has to be taken off. And
it's always complex.
That was my Tuesday. My 6:15 patient was a cast removal, had to get an x-ray, like the whole 9 yards, and showed up at 6:29 p.m. after starting the OR at 7 that morning. And I'm like, really?
But you're still going to see him.
Yeah, I did. Yeah.
I
was still pleasant about it all. It was funny, so it was fine.
All right, OR stuff.
Okay. Yeah.
In the OR world, would you rather, if something isn't perfect,
right?
Okay, and let's talk reductions. Let's talk, pinnings. If something's not perfect, or closures, will you go back and redo and recheck and obsess about it, or will you say nothing? Like if you're not in control of it. So maybe not the closures, but like, let's say hypothetically when you're operating with another surgeon.
I was going to give that caveat because my surgeon is very type A and very particular in that scenario. I don't foresee ever happening. Like,
oh my God, that was very nice of you to say.
yeah,
that's great.
Yeah.
Yeah. But okay, so you're operating with somebody else.
If I'm operating with somebody else, like, am I going to say something out loud? No. But am I going to make eye contact with the rep? Yes.
Yes.
Yeah.
Yes.
I will definitely make eye contact with the rep. Like, is that screw in the joint? Are you seeing what I'm
Yeah. But professionally, you're going to say something, not say something? Or situationally depends?
It situationally depends because like, you know, well, it's all about the patient outcome, whatever. But like, yeah, it depends on who it's with. Okay. It depends on how bold I'm feeling, I suppose.
Yeah. I would answer that exact same way. If I'm feeling spicy, I might say something.
Yeah. Yeah. Like, ooh, should we get another angle of that view?
That looks a little long.
Yeah.
To me.
Yeah. But fortunately I don't live in that world. So as far as closures, I will redo something if I really don't like it.
You'll start over again.
I will start over again.
I will too.
I absolutely will.
Do you ever, if you are working with your physician leaves the room and he has closed something and you don't like the way it looks, will you undo it and redo it?
I mean, he doesn't do a lot of like the closure stuff for it, but he will say himself, like, if you don't like what I did, take it out and redo it. So, okay. So I'm given that open door.
Okay.
Do I? No. Yeah. I mean, in less of the case of like we do revision amputation sometimes, and like as you progressively get farther, maybe somewhere down the line, it's like not matching up anymore. So yeah, I'm not going to say never, I guess, but
okay.
Yeah. Okay. Another OR addition for you.
Okay.
What would get your heart rate going more? You show up and the rep doesn't have the implant, or the patient shows up with different expectations of what's being done. Like the doc goes to sign them and you did their pre-op and they're like, wait, nobody told me about this. And you're like, I did. Wait.
And if the rep has the wrong implant, I'm going to go with the patient expectations, because if the rep has the wrong implant, which shout out, ours really
I was gonna say, like,
but we actually can roll. Like we are very innovative with, okay, we'll just go with this one. Even if it's not like the perfect thing, we'll just go with something else. But more so, it bothers me afterwards when like I do my pre-ops and I will walk patients through and I will give them worst case scenario. Like you know, pain may be this. And I will say, prove me wrong. Like, I just want you to be prepared for this because it's better to be prepared than not. Afterwards, the doc will meet with the patient's family member in the conference room and just go over, and it should be just a very superficial brief, because they should have already gotten
this is what happened. Yeah, this is where we ended up.
So we did a 13-year-old MPFL this week. I think it was Wednesday. And I don't operate on Wednesday. My coworker does. So I did the pre-op. The dad came in for the pre-op. Okay. Red flag number 1.
Okay.
It was their daughter, right? So she couldn't take pills.
As opposed to the mom?
Yes.
Okay.
She couldn't take pills. So we had to talk about liquid. She was all freaked out about the IV. So she wanted to know if she could take a small, because she doesn't do pills, a small anxiety pill beforehand. So I was like, I will go the extra mile. Like found out if she could take Ativan. Yes. I like dosage specific. How small is the pill? Will she be able to swallow it? Yes. Okay. Liquid hydrocodone. I said, listen, it's like a week ahead of your surgery. This is always a problem. The pharmacy like doesn't have it, or they need it written a certain way, or they're going to call their like sister pharmacy, whatever. So of course they called back and, oh, the pharmacy doesn't have it. No, it's too expensive at this pharmacy. Send it to another one. And I was like, it's literally not going to matter, but okay. So-and-so on my team was like, hey, can you resend the hydrocodone? So I just routinely resent it. Guess what? They didn't tell me that it was the liquid. So I resent
you just
it.
Did the basic,
resent it as a pill. So the patient called back. They're all mad.
Yeah.
So in the pre-op, I had said, is there any other questions your mom would want to know? And they were like, I don't know. The dad was like, I don't know. Like, I'm going to be at home and she's going to be like, oh my God, did you ask this or that? So I said, they're going to ask about driving. They're going to ask about sleeping. They're going to ask about therapy. They're going to ask about when you go back to school.
Yep.
He's like, oh my God. Yeah. When we do all that stuff. Right. So I did all that. And then after the surgery in the conference room, the doc went to go talk to them and was like getting ready to leave. And then the mom was like, what about this? What about this? What about this? What about this? So he came and he goes, who did their pre-op? And I was like, I did. No. And the mom wasn't there.
Yeah.
He's like, well, she's so confused. Can you just go talk to her? And actually, sorry, I wasn't there at surgery. So then it's someone else talking to her. I'm like, God damn it.
Yeah. Yes. And then it's like you don't even have the opportunity to defend yourself because like
No,
now you're away from the situation.
Yes.
And you're like, is everybody just thinking that I did a bad job? Like why?
Yes, that's what everybody thought. So afterwards I hear about it the next day.
Yeah, I know.
And then I'm like,
yeah.
But yeah, so if the rep doesn't bring the right thing, I'll make fun of him for like 30 minutes, but
and then everything's fine.
Then everything's fine.
Both make me very stressed out because my immediate what I go to in both scenarios is what did I fuck up?
Oh yeah.
Like, did I not tell them about something? Did I not put it in the order? Did I black out during the pre-op and not tell the patient what we were doing? Like, what did I do?
Yeah. Yeah.
So,
would you rather, this OR edition for you, would you rather operate in a room where you don't like the CRNA or you don't like the scrub tech?
Ooh.
Like which one is the worst evil?
Like,
because you're operating right next to both of them.
Okay, I'm going to answer it first and then give my caveat. Don't like the CRNA because far less interaction with them typically.
Yeah.
Although I do like interacting with the CRNAs. My caveat to that was that I fortunately don't work with any CRNAs that I don't like. Well, now at least. I'm not saying I never have, but like on a regular basis now, I really, really like everybody that I work with and I do interact with them regularly because of that.
Yeah.
But I think it would be harder to get through something with a scrub tech that you didn't like.
Yeah.
You know?
Yeah.
And I mean, we work with such like a rotation of people. It's hard to even, I mean, the steady ones that I work with regularly, I do really like, but we almost have like a revolving door because we go to different facilities and everything. Yeah. And then they always have people who are traveling and I don't even like have enough time to develop a relationship with most of those people.
Okay.
Yeah.
Good answer.
So CRNA for sure. Okay. I don't know where to, I mean, I could do this all day. I gotta find a final one at some point.
Well, yeah, let's go into the, provider personality and then.
Yeah. One from each.
Crossover. Sure.
Yeah. Okay. So then, let me ask you a personality based one.
All right.
I already know the answer. Well, no, I don't know that I know the answer to this. So no, I do. What you would spiral more over, a bad review or a complication? I feel like, a complication.
A bad review.
Really?
Yes. A bad review.
And I don't.
Yeah, no, a bad review.
I mean, I do spiral over those, but like, I guess it depends on the type of complication. Again, my mind goes to what did I fuck up personally? What is it about
I think
me?
from a logical standpoint, a complication, when someone gets an infection or something like that, I no longer am at the point in my career where I'm like, oh my God, did I have a hole in my glove? Like it's just not that. Or if somebody's rotator cuff repair failed, like that's just not
it's thing. Not on you.
It's not on me. It's not even on the doc. Right.
Or the patient really. Like it's just like
there's very little things. I would say returning someone back to sport ACL wise when they weren't quite ready, because there's metrics that we use and then there's personality of the patient. I've had one
did I
patient
make the right decision with that?
Yeah. I had one patient I sent back to play. Again, it's a whole other story, but she first came back. She afterwards said that she wasn't ready, jumped up to celebrate the goal she scored, landed, tore her ACL.
Ooh.
Yeah. But again, met all criteria on paper, but that one still haunts me a little bit. But I wouldn't even call that a complication. Yeah. But the bad reviews, I just never knowing and never writing those. They never, not writing, but never like correcting those. They haunt the crap out of me.
Yeah. And especially the ones you don't know, like who did them or who wrote them or
especially
what it's about.
Because like I also don't feel like I have an ego or a personality that is such that I need to tell them I was right. I just like, I go down this rabbit hole of like, do they really think that I was here today for them to piss them off or to tell them crappy advice or to mislead them? Yeah. Like, I feel like when you have someone who's so angry that they're going to write a negative review that they know everyone's going to see, they want to do it to hurt you.
Yeah. And like also when you're going to write the review, you could probably see other reviews that people wrote and like see the trends and be like, maybe I'm the problem here and not this
but I
person.
don't. But I don't come in to hurt people. Like I don't come in to hurt people's feelings. I don't come in to give shitty advice. And when someone like does that
hurt them with injection,
I don't plan to do that. But when someone does that to me, it really bothers me.
No, it is. I mean, I spiraled over one this week, so it wasn't even like my fault. So
I know. Well, I have a question for you. I know.
Okay.
I know the answer to most of these. I know which you secretly prefer the OR days opposed to clinic days. I know that.
Yeah, we know that.
I think I know what motivates you. I think I can ask you about time off. Would you rather go to a conference or the beach?
You know the answer to that too.
All right. I'm going to go provider.
Personal.
I'm going to go personal. Okay.
Yeah.
Okay. What do you value most in a co-provider? Their loyalty to you or their competence as a provider? That's a great question.
That is a really, really good question.
Happy you brought that up.
Okay. When I answer this, I don't want it to come across as though I'm answering it that B does not exist because I'm choosing it.
I'm getting hot again.
I'm uncomfortable, but definitely loyalty. Like I'm going to choose A, which again does not mean that the competence does not exist. But if I had to choose what's most important to me in that relationship, it's going to be loyalty. Because like
I get where you're coming from because I think being a PA, you need that to want to continue to do what you're doing.
Yeah.
And it's not that you grow competent together. That's not a thing. You come into it with a certain level of competency, but that like, I feel like you as a provider and the surgeon you work with, you guys get better the more that you do. That's just a fact.
Yeah.
Loyalty is like, if you were
loyalty
perfect
helps to
and
build
he was
that.
perfect,
Yeah.
and you were like the best and he's the best and you guys didn't get along and he was talking behind your back and you're talking behind his back, like that would bother me more than someone that did a subpar distal radius fracture, because you know that someone's going to be better. Yeah.
I mean, again, we're not out here doing subpar shit. So
that's true.
they look fire.
Disclaimer.
Okay.
Everything
Disclaimer,
is fire.
They're perfect. We're both very type A. Everything we do is perfect. I'm just kidding, but you know,
no, that matters.
Needless to say, like, yes, I think the loyalty aspect is very important. I would think to both of us.
Yeah.
Do you agree?
I agree.
You think?
I 100% agree.
Yeah.
I think loyalty is really important. Competence, like, again, I thrive on that. I think when I see my surgeon do new innovative stuff.
Yeah. Oh, I love that too.
Oh my God, I love that.
Yeah.
Like that excites me, and I value that because I think working with someone who's stagnant is,
and like wants to continuously get better and try new things and do new things. And I think like being on the same page, like you guys are both like, you know, ideas and do new stuff, and you're doing it. You're crushing it with lots of stuff right now. Yeah. On new heights.
Yeah. New heights,
what did I call it? Like, different life stages.
Different life stages. That's right.
New life stages.
Okay. I have one more for you.
Okay.
This is, again, it's more clinic and more provider specific.
Okay.
Would you rather teach a student or train a coworker? Like, who would you rather put your value in?
So for a PA student versus a PA coworker, like training them for urgent care or something?
Something, yeah.
I think somebody that we just hired rather than a student. Well,
I like the students better.
Yeah, that's tough.
Because I feel like you can mold the students.
Yeah. I guess, it really depends. Like, are they fresh out of school and like super eager and like very malleable? Or are they somebody that like has already been doing their own thing for the past 10 years and the advice you give to them, you're like trying to tiptoe the line of, am I insulting them because I'm telling them what to do? Or like, are they wanting this advice from me, or do they think I'm dumb? Like, where are we? Whereas the student is like ready to absorb
give
whatever.
Me everything. Yeah.
So I see that reasoning behind it. But I think from like a making things more efficient standpoint, I like training people who are working here. Yeah. Because then down the road, you benefit from it.
Part 2 to that.
Okay.
Would you rather teach them everything you know, or do you keep tidbits yourself because no one will be as good as you? Just asking.
We all have to have our secrets, okay?
No, but that is, I will teach you everything.
We all have to have our secrets.
But I will teach you everything you need to know,
right?
Not everything I know.
I need to. Yes, exactly. You don't need to know what I know. So 100% true.
I think I know the answer.
Yeah, no, the answer is I'm not going to teach them everything I know, because what the fuck am I then? I'm not like trying to create clones of myself. I'm trying to like be better than everybody else.
Yeah. But make them better than
they were.
The mass.
Yeah.
Better than they were, but not as good as you.
Right. Yeah. But in order to accomplish that, I also have to be constantly bettering myself, because then at some point, they'll be here and I'll be here and we'll like even out. So I got to be like, we all got to be like going here all the time. Do you keep tidbits to yourself?
I keep tidbits to myself. Yeah. Even like to this day.
Yeah.
Like, I'm not stupid.
Well, I'm glad this is a common thing that we have.
That's just wisdom, Hannah.
It is wisdom. No, I mean it's fucking job security is what it is.
No, it is job security. So, that is true.
Yeah.
That is true.
Yeah.
Well, I'll be honest. Some things you said surprised me, but I also think I know you very well.
Yeah.
Yeah.
I think
like
we're similar
in the dating game right now. Like, I feel like I know you very well.
Yes. Yeah. We would have won some sort of like Family Feud.
Yeah.
Know your significant other type situation. So
definitely
very successful. All right, guys. Well, happy Valentine's Day. Until next time.
All right. Have a good one.
Thanks for tuning in to Joint Effort PAs. If you enjoyed this episode, be sure to subscribe, leave a review, and share it with a fellow PA or med-minded friend. You can also follow us on Instagram at Joint Effort PAs for updates and extra content. See you next time.